Hello, and welcome to Adolescent Medicine Consulting's video of the week for the week of March 11th, 2024. My name is Mira Bihari. I am a pediatrician and adolescent medicine specialist with over 20 years of experience working with teens, tweens, and young adults in a variety of settings. I started Adolescent Medicine Consulting to help share some of what I've learned over the past 20 plus years to you so you can use this to help the teens in your practice and in your life. For those of you who have been tuning in on a regular, thank you for continuing to tune in. Today, we're going to continue our series on what to do when teens present with different problems that they express during the psychosocial assessment. If you are new to this series, welcome. Please watch this video and then look back at some of the other videos on how we can help teens as they're dealing with stress or different problems in their home setting. Today, I'd like to jump in and talk about 3 resources to help with school and some common school/educational problems that present to us in the primary care office. As a reminder, these videos are for educational and informational purposes only. They are not a substitute for your own clinical judgment and do not constitute a consultation. If you feel like you have a patient who needs an actual consultation, please feel free to reach out to me so I can help point you in the direction of a physician in your area, or check out the Society for Adolescent Health and Medicine's Find a Provider website. If one Googles common school problems, among the things that pop up in the top 10 are issues with bullying or violence, concentration issues, and poverty in a variety of forms. So these are the 3 problems that I decided that we are going to focus on today, just because you're probably seeing this in one way or another in your practice. All of us who work with adolescents love the data from the YRBS, the Youth Risk Behavior Surveillance Survey, and we are very happy to see data coming out from the 2021 survey that was done. Sadly, there are some things that have not shown areas of improvement, and bullying is one of them. Most parameters that were studied either stayed the same or got a little bit worse, such as kids who were avoiding school or not going to school because they were worried about violence at school. What we know is that students who are bullied are more likely to have multiple sexual partners, more likely to have sex without a condom, to use different substances, and to experience depression. Over the decades, there have been lots of initiatives and movement to prevent bullying in school, and resources to help young people as well as the adults in their lives have also sprung up. One of those resources is StopBullying.gov. This is a website from the US government, and it deals with a bunch of different information and resources to help kids, teens, and the adults in their lives deal with the problem of bullying. And that can be adults who are parents or adults who are teachers. There are toolkits, there's some practical advice, there's links to helplines, tons of information, and even a place to link out to some mental health support in your area if that's something that you need for yourself or for the young person in your life. Tons of information honestly can be a little bit overwhelming, so I do tell people, if you're going to send a patient to this website, guide them through the website a little bit, show them where the resources are, show them where the kid's specific data is, and familiarize yourself with that for a few minutes at least before you actually give it to a patient. One of the things we know that actually helps with bullying a lot of times is, rather than trying to stand up to the bully in a situation where that might actually put another young person in danger, we are encouraging people to speak out when they see bullying and or help the person who has experienced bullying and let them know that they have an ally and they have some support and they are not alone in their suffering. Concentration is a common problem. I don't know about you, but I have lots and lots of patients who think they have ADHD, and some patients who are just high overachievers and think that if we give them the medications, they're going to move from a B to an A. That's a whole discussion for another day. But we do know that concentration and grades changes are something that we see quite commonly in the pediatrician's office and the primary care doctor's office. And when there are problems with concentration, it can be signs of lots of things. It could be a sign of anxiety. It could be a sign of ADD. It could be a sign of anemia, especially if it's a young woman who's started menstruating and is having very heavy cycles. She might have developed anemia. So these are some of the things that we need to look out for. Thyroid problems is another thing I tell people to do a little test and figure out what's going on there before we jump to running through the Vanderbilts and the different screening tools to look for ADD that might have popped up. That being said, I have had many patients where we are only first discovering that they have ADD or ADHD when they are an adult or an older teen. They have been white knuckling it throughout their elementary school years or had a really great memory or other tools that help them survive. But when the material gets more complex and they are more independent in their studying, we start to see some problems. So I do recommend that we follow the current guidelines from the AAP and do universal anxiety screening. When there is a concern for concentration problems, I recommend sending the patient and their parent with some forms for the teachers at the school to fill out so we can see what the level of functioning and performance is for the young person. Oftentimes from those screening tools, we'll see that it's actually less of a problem with concentration, maybe a conduct issue, maybe some anxiety or depression, maybe some other factors that we didn't even know were going on, like bullying, are affecting the young person's concentration. So we definitely want to do our due diligence and do all of the screening. If we find out that the patient does have ADD or ADHD, we want to give them as many resources as possible. Medications, again, whole other topic. Symposia are held on the topic of ADD, ADHD, and its treatment. I like to point out this resource, CHAD, that has tons of information about ADD and ADHD to help teens, adults, and the people who work with them, whether that's teachers or, in the case of adults, their colleagues. As you can see, for this month, because it's Women's History Month, we are talking about, CHAD is talking about how ADHD uniquely affects girls and women and how it looks a little bit different as well. With the bullying website, I like to point out to people that there are different tabs and different areas of focus. And so sometimes it might be that I go through the Understanding ADHD tab with the family and I let them know that this is, what ADD is and what it isn't. For some families who think that their kid might have ADD, but it's really that they're not getting the A++ that the family wants, but they're still really smart and really brilliant and wonderful people. There's some education and advocacy information, as well as some tools and options for getting support, linking to someone who is specialized in treating ADHD in your area, and the option of getting involved, whether it's becoming a member or volunteering. They also, of course, have some products and some books to help with understanding ADD and thriving really despite ADD. For those of you who are interested, there is a wonderful resource from freepsychotherapiebooks.com that I have personally enjoyed from a gastroenterologist who decided to write about his experience having ADD that was not diagnosed until he was an adult. And one of the things he says, which I love, is that the medications will only get you so far at any age that you are dealing with ADD or anxiety or really any health problem. We've got to do other things to help make us thrive with whatever condition we might be dealing with. So in the case of ADD, it might be that we need to have like a set place for all of our items and have a routine and also think ahead about our schedule and really work on some time management skills. Message me for some more information about that free book from freepsychotherapiebooks.com. In the meantime, check out CHAD and some of the other resources that we have mentioned for ADD. As many of you know, significant segments of our population, of the children in our population, live in poverty. About 12 to 16% of kids, they experience hunger, they experience lack of access to school supplies, lack of stability in school, frequent illness, which leads to absence from school, interrupted sleep, and lack of study time, either due to an environment that is not conducive to sleep and study, or to having to help their family out financially or with other tasks in order to make ends meet. This leads to significant challenges with being able to perform academically. We also know that when students do not have adequate resources, they are unable to participate in certain extracurricular activities, which require funds for like paying for uniforms and supplies and field trips and all of these other things that make the educational experience more robust. For kids who have experienced homelessness or are experiencing homelessness, there are resources from the National Center for Homeless Education that can be accessed through their website, nche.ed.gov, or by calling the hotline 800-308-2145 or sending them an email, homeless@serve.org. In the past, when I've reached out to them, they've been very quickly responsive, and I strongly recommend this resource. If you know that a child is experiencing homelessness and you need to connect them to their school liaison, or you're not entirely sure that they are experiencing homelessness, they also have a list of the local and state homeless education coordinators to help provide that linkage. Obviously, there is tons more that we can talk about with education and some education challenges that students might have, your patients might have. Talking about the different screening questions we ask is, again, a little bit more than what I want to do in these videos, but I'm happy to do in other settings. You can reach out to us at adolescentmedicineconsulting.com or reach out to me at Dr. B. Harry at adolescentmedicineconsulting.com. That's dr.BEHARRY at adolescentmedicineconsulting.com. If you found this video helpful and would like to receive some CME credit for it, by all means follow the information in the text box associated with this video and click the link to get some CE credits for a small admin fee. Please keep tuning in to these series and these videos to learn more about what you can do to help the teens in your practice and in your life. Thank you for your time. Take care.